Managing personal triggers and bias. The art of managing personal triggers and biases in therapeutic settings is a complex interplay of self-awareness, continuous learning, and professional development, necessitating a thorough understanding of both psychological and sociocultural dynamics. This lesson seeks to explore the intricate dimensions of these concepts, offering advanced insights and actionable strategies for professionals engaged in therapeutic partnerships. At its core, managing personal triggers involves recognizing and regulating emotional responses that may be activated by clients' behaviors, stories, or even subtle interpersonal dynamics. These triggers, deeply rooted in one's personal history, values, and unresolved conflicts, can hinder the therapeutic process if not adequately managed. Theoretical frameworks, such as Dan Siegel's interpersonal neurobiology, provide a foundational understanding of how brain function, emotions, and interpersonal relationships intersect, suggesting that self-regulation is a critical component of effective therapy. By cultivating mindfulness and engaging in reflective practices, therapists can enhance their capacity to remain present and empathetic with clients, thereby fostering a more supportive therapeutic alliance. Bias, on the other hand, often manifests as preconceived notions or attitudes towards specific groups or individuals based on race, gender, sexual orientation, or other identity factors. Addressing bias requires a rigorous examination of one's belief systems and the societal structures that reinforce them. Critical race theory and feminist psychology offer valuable lenses for unpacking these biases, encouraging practitioners to consider the systemic and cultural dimensions that inform their perspectives. This self-reflexivity is crucial, as unchecked biases can lead to microaggressions or misinterpretations in therapeutic settings, ultimately undermining the therapeutic relationship. From a practical standpoint, implementing strategies to manage triggers and biases involves both personal and systemic interventions. On a personal level, engaging in regular supervision and peer consultation can provide external perspectives that challenge ingrained biases and highlight blind spots. Furthermore, adopting a stance of cultural humility, as proposed by Hook et al., emphasizes the importance of lifelong learning and openness to understanding clients' diverse backgrounds. This approach moves beyond mere cultural competence by fostering a mindset of ongoing curiosity and respect for clients' unique experiences. On a systemic level, integrating bias reduction techniques into organizational practices can create a supportive environment for therapists to explore and address their biases. This includes providing regular training on diversity, equity, and inclusion, as well as developing policies that promote accountability and transparency. By embedding these practices into the fabric of therapeutic settings, organizations can facilitate a culture of continuous improvement and ethical responsibility. Competing perspectives on managing triggers and biases often revolve around the balance between individual and systemic change. While some scholars emphasize personal accountability and internal reflection as the primary means of addressing these issues, others argue for a broader structural approach that tackles the societal forces perpetuating bias. For instance, a debate between proponents of implicit bias training and critics who question its efficacy highlights the complexity of affecting change. While implicit bias training has been shown to increase awareness, its long-term impact on behavior is contested, suggesting the need for multifaceted interventions that address both personal and systemic dimensions. Emerging frameworks, such as intersectionality, as conceptualized by Kimberlé Crenshaw, offer a nuanced understanding of how various identity factors intersect to shape individuals' experiences. This framework is particularly useful in therapy, where clients' multifaceted identities must be acknowledged and respected. By adopting an intersectional lens, therapists can better appreciate the complexity of clients' lived experiences. moving beyond reductive categorizations and fostering a more holistic therapeutic approach. To illustrate the practical application of these concepts, consider the following case studies. In the first case, a therapist working with a client from a different cultural background encounters challenges when the client's expressions of emotion conflict with the therapist's cultural norms. By reflecting on their personal triggers and engaging in cultural humility, the therapist acknowledges their discomfort and seeks supervision to explore their biases. This process not only enhances the therapeutic relationship, but also deepens the therapist's understanding of cross-cultural dynamics. In the second case, a therapist working in a community mental health setting encounters systemic barriers that reinforce racial inequities. Through advocacy and collaboration with colleagues, the therapist initiates a project to address these disparities, drawing on critical race theory to inform their approach. This initiative not only benefits the clients, but also empowers the therapist to enact meaningful change within their organization. In conclusion, managing personal triggers and biases in therapy is an ongoing journey that demands both personal introspection and systemic action. By engaging with cutting-edge theories and adopting practical strategies, therapists can enhance their capacity to hold space with compassion, ultimately contributing to a more equitable and transformative therapeutic landscape.